this is Dr. Richa Mittal talking to you today about intermittent fasting. I know there's a lot of information out there, and you probably have already learned a little bit about it if you've been following my stuff that I put out, and there's a lot of different doctors talking about it online. I wanted to just share with you a few tips on how to get started, and also some tips on how to keep going, because sometimes it can be a challenge when you're first starting out. So the first piece of advice is that intermittent fasting is flexible. So you can plan around social events, and you can plan for if you're going to have dinner with your family, and that's a great way to incorporate it into your lifestyle rather than it making you a social pariah. Next, go at your own pace. Everybody's different, and everyone's in a different place as far as their fasting journey is concerned. So I recommend that first of all, you make sure you don't have any chronic medical issues that you can talk to about with your doctor in case you are someone who should not be fasting. Also, if you have a history of eating disorders, or you're pregnant or nursing, you shouldn't be fasting. So if you are cleared by your doctor and you don't have any medical issues, the best way to get started is just to start small. So perhaps having breakfast a few hours later, or wrapping up dinner a few hours earlier, and eating within a particular time window will get you started with what's called time-restricted eating, which is basically saying that you're going to eat during a particular period, for example, during an 8-hour window, and then you would be fasting for 16 hours. The next tip is to stay hydrated. A lot of times, thirst is mistaken as hunger. So it's always great to first have some water or tea or lemon water, something like that, in case you start getting hungry during your fast, because often it can be a sign that you're thirsty. Also remember that hunger comes in waves, so we don't feel hungry continuously. We actually get hungry at the time that we're used to eating. So expect to have hunger then. Give yourself 15 minutes, drink some water, and then tell yourself that you will revisit that hunger in 15 minutes. And if you're still hungry, then you might decide to break your fast. And if not, you might find that you can go another hour or two without getting hungry again. The next tip is to stay busy. So when your mind is distracted and you're doing other things, you're just not going to think about food. The next thing is, when you end your fast, you need to eat as if you never fasted. So what that means is you're still building a meal with the components that should be there. You have your protein, your good fats, your fiber, your vegetables, and it's not an excuse to just binge on a bunch of junk food, because that isn't really the point of the fast. The next thing to remember is that fasting can be broken at any time. You're not starving yourself, you're actually just choosing when to eat and when not to eat. So I hope you find these intermittent fasting tips helpful. If you have questions, please comment below. And please remember that this is not medical advice, and if you have particular questions or concerns, please consult with your personal doctor. Thank you.